bit. The last slide was this one here, and we talked about all of that stuff. Just as a final note about this picture, because this is such a cool picture actually. If you notice up here is the pharyngeal tonsil. And you see, you can't really see it from the front. So the way you get that is you reach back here and push the uvula and everything up, and then you can usually see it and grab it and take it out. So when you have a tonsillectomy, they call it a TNA, a tonsillectomy and adenoidectomy. These are the adenoids up here. That's another name for the pharyngeal tonsil. And it's swelling of this one up here that gives kids all kinds of, and adults too, all kinds of snoring problems and troubles with breathing and so forth. And I can tell you, if I didn't tell you the story before, my granddaughter had a TNA about a year ago, and it totally changed her. I mean, she's a different person. She doesn't get sick anymore. She doesn't snore at night. She has grown up and gotten bigger and stronger, and it's just made a real difference. So we used to do routine tonsils on everybody. I remember when I was first starting in surgery, it would not be unusual to go in and see the surgery schedule, and there would be 5 kids from the same family, all 5 of them scheduled to have their tonsils out on the same day. Because that's the way they did it. It was like wholesale TNAs.
Well, that my mom and dad only have to pay that for once.
Yeah, that's right.
5 times
Yeah,
harder.
and they only have 5 times as much of a chance of losing one of their kids too. But anyway, enough said. And I don't know if I also told you the story, but I never did a tonsillectomy. But I walked in on this old guy out in the Dalles who was doing one day, and I said, "Hey, can I see what you're doing? I've never seen one of those." And he says, "Yeah, just a minute." He's kind of retracting back in there, and he says, "Just a minute." He grabs the uvula and cuts it off and says, "Now you can see better." And I'm like, "Really?" I couldn't believe he did that. He was crazy as hell.
What happens when you look in your throat and you notice
You don't have a uvula.
like we're gonna
Yeah, see, there's what you see. That person didn't see that anymore. Actually, your uvula is actually important. It keeps you from snorting up milk into your nose.
Does it also help aid with you decide when you swallow, but then it kind of blocks it until you
Yeah,
decide?
it does. It blocks the upper part. It blocks off the nasopharynx, so the stuff doesn't go up. That's one of the functions of the uvula. See, it's attached to the soft palate back there. It's all soft and it moves up. Okay, so I think we've seen most everything here. This little thing right down here is called the lingual frenulum. That little hung right there, it kind of attaches to your bottom of your tongue. And if it's too short, then you're tongue-tied. And some kids are born with a really extensive lingual frenulum, and they have to go in and just get just a little snip to release their tongue so they can stick their tongue out, and also so they can talk well. Otherwise they can't talk very good because the tongue is stuffed down there at the bottom of their mouth and makes them talk funny. It's easy to fix. And no, I'm not mimicking a disabled person. Well, I sort of am, but for educational purposes only. The other thing I want to show you here is just the tongue. On either side of your tongue are the openings to the submandibular ducts. And when I was teaching junior high school, one of the big deals that kids were really gross at was they would gleek. You know what gleeking is? Yeah. Somehow or another you move your mouth and your jaw and your tongue and stuff, and out comes this little shot of spit. And it's coming out of those 2 little ducts right there, and they're coming from the submandibular glands, which we'll talk about in a few minutes, but they're way down here. But they have a duct that carries it up to there. That's good enough. Tongue, tongue, I think we talked about it the other day. It's very fun. It's very important in mechanically processing your food and moving it around and assisting in your chewing, getting it ready to swallow. It's also important because it tastes. Remember, your taste buds are on your tongue. Well, hi, Susie. Glad you could make it today. I know. Did your kid get thrown out of school because of that?
No,
Oh, good. All right. The struggle so many of you face, it's just, I'm so impressed by the hoops you all jump to come to these classes. It's great. Thanks for coming.
Thanks for being here.
taking me.
I feel like this is like every time the bell rings
That's
and
the
you
last
don't get
compliment
this
you'll
week.
get.
Like
All right.
every time. A nursing student gets accepted.
Yeah. Anyway, so our tongue tastes up and tells us whether it's too hot. If it's too hot or if it tastes terrible, we'll probably spit it out. Our tongue does make one thing that's important. It makes this stuff called lingual lipase. Now, what do you think lipase is? It's an enzyme that does, it digests fat. That's right. So you actually have a little bit of fat digestion actually starts here in your mouth. We talked about the amylase that was in the saliva that starts the breakdown of starches, another enzyme. Okay. Salivary glands, there's 3 pairs of them. You ought to know the names of them and where they're located somewhat, and probably where their ducts empty into your mouth, because that's kind of important. They're different cellularly. I'm not going to expect you to be able to tell the difference between the parotid gland and the submandibular gland and the sublingual glands under the microscope. That's silly. Think about it. You're in the pathology lab at the hospital, and somebody hands you a piece of glandular tissue and says, "Okay, tell me what gland it came from." No. Tell me where it came from off the operating report, right? I mean, you're never going to be put in that position, so I'm not going to put you in this either. Anyway, so they are a little bit different. I'm going to show you pictures of them, but please know that you don't have to know how to tell the difference between them. The parotid glands live right up in here, just inferior to your zygomatic arch. Remember that? Zygomatic arch? And they make a pretty watery serous secretion. It does have this, it has a lot of amylase in it, in your parotid gland, that starts breaking down those starches like we talked about it. We chewed on a saltine cracker, remember? The parotid glands are up in here in your cheeks, and they drain through this duct which is called Stinson's duct and comes down here and empties into the side of your mouth, from across from your second molar, right here, see? Empties into the vestibule at the second molar. Yeah. Okay, so that's one of them. These guys here, just so you know the rest of the story, because not too much goes wrong with them, they do form cancer. I think I took 2 parotid glands out in my whole career. It's a pretty rare problem, but parotidectomy did happen from time to time. John McCain had one of his parotid glands removed because he had a cancer growing in there. The politician guy who isn't getting along well with the orange man. Anyway, that's the parotid gland story. And I told you the story about the little stones that form in the duct sometimes.
Yeah.
Okay. Oh, the other thing is that boys, doing general surgery, I did examined thousands of people for inguinal hernias. And when you do that, you also examine their testicles. And the reason I say that is because if you examined 1,000 people down there, you'd find that probably 50 of them had either one or both of their testicles was really shriveled up. It was like the size of a lima bean instead of a normal testicle. And that's caused by mumps, the mumps. Mumps is a virus And the reason it's called the mumps is because one of the places that virus affects is your parotid gland. Makes you look like this, and it got the name mumps from that appearance of the kids. A lot of times it's kids, but sometimes it's later in life. If it's later in life and you get the mumps, you're probably going to lose a testicle if you're a guy. Not lose it, but it's going to shrivel up so it doesn't do anything for you. You probably won't be sterile because if your other one's still okay, but it's an important deal. And you know, whenever I hear about people holding their kids back from getting their MMR, their mumps vaccine, all I can think is those 50 guys who wandered into my office and didn't have a testicle because of it. Now, that may not seem like a big deal to you, ladies. As long as the other one's working fine, you probably think that's just fine. But let me tell you, when you're a middle school student and you go to the locker room and you've only got one, everybody in the locker room is going to be pointing at you and you're going to be called one hung low or something like that, you know, because it's a big deal. And a lot of kids who had a missing testicle or one that's really shriveled up.
Will one hung low be on the exam?
Maybe so.
What's a great nickname for a kid who's
Anyway, the problem is it's a big deal. A lot of kids would even come in and have a plastic testicle put in their scrotum so they didn't look funny in the locker room. So, you know, those are things that don't get put on the news when they're dealing with the anti-vaxxers. Nobody stands up and says, well, hey, do you know that maybe 50 out of 1,000 kids lose a testicle if they get the mumps? And then what would people think, you know? So I'm pretty passionate about vaccines because I know there's lots of diseases that have been eliminated off the face of the earth because of vaccines. And the silliness of not getting them is just not there. There is no scientific evidence for any of the problems that are stated. So please get your kids vaccinated so they won't be called one hung low. There you go. You won't forget that, will you?
No.
All right. The second set of salivary glands is called the sublingual salivary glands. And if you look in your mouth, if you take your lab partner, get a piece of paper towel or something, and they grab their tongue and hold it over to the side and kind of lift it up, right alongside the lingual frenulum in there and extending back from that, you can see this salivary gland right through the mucosa of your mouth. It looks like salivary tissue. I mean, it looks like glandular tissue, and you can see it right through the thin little skin that's over it. It makes a little bit more mucus secretion. And the thing about it is it doesn't have just one duct. It has a whole bunch of them. So you can't squirt or anything with it. You can't gleek with these guys. It's just a whole bunch of little holes there, and it just kind of drains out. And they're pretty small as well. As you see here, the lingual ducts, also called rivenous, I've never said that word before, come out on either side of the lingual frenulum. And then the last one is the submandibular glands that are down here. They're in your neck. It says in the floor of the mouth, but really the way you get at them is here. They're not superficial like those other ones were. And they have a duct that also, they have two ducts, one on either side. They're called Wharton's ducts, and those are the ones that open up right in front on either side of the lingual frenulum, and those are the ones you can gleek through. Okay? So you ought to know that.
So you gleek with the submandibular.
Yeah, you gleek with the submandibular, not the sublingual, not the ones that are just right there. And you notice here that the submandibular ones, these ones that are down here that you do gleek with, they make about 70% of your spit. And 25% from your parotids. Those sublingual ones that just kind of bubbles out of them, they don't make very much of it at all. A total of 1.5 liters a day, though, that's a lot of spit. You know, that's, yeah, there you go. She's been spitting in that all day. Look how much she's gotten so far. Yeah, she's going to fill it up by the end of the day. Yes, ma'am?
Which ones make your mouth water? Like
Well, they all do. They all,
Okay,
yeah,
so
they all pour water into your mouth.
Like when you are having a response to like seeing something that tastes good.
Something that tastes
Like,
good?
yeah, so like when you see something, they all water?
Yes, yes. And is that sympathetic or parasympathetic?
Parasympathetic.
Parasympathetic, that's right. Okay, so here's a picture of all three of them. Here's the parotid gland right here below it's right in front of the ear actually. And notice that the duct, Stenson's duct, runs up through the cheek and it empties into the mouth right there across from the second molar. The second one, the sublinguals, are right there under the mucosa of your mouth, and they have a whole bunch of little ducts that open and drain them. And then the submandibulars that are down here in your neck, they drain through a single submandibular duct on each side, and they come out right here in front. And those are the ones you bleep with. This is what they look like. What this one looks like under the microscope. I do not care that you can identify them, but you shouldn't be. When you look at that right there, it should look to you like glandular tissue. And you know, these are all glandular cells. They're making proteins and they're making water, mostly water. Here's a duct that runs through it right there, lined by what looks like columnar or I think they are simple columnar cells. What is saliva? It's about 99.4% water. There's very little in it. There's just a little bit of electrolytes, a little bit of buffers, like a little bit of mucin. So it'll hold together as a loogie. You know, you need a little protein in there to make it stick together. Antibodies, enzymes, waste products. I don't know. It's just all water and a few enzymes. What is the function of spit? Lubricates your mouth, keeps your membranes moist in your mouth. It starts digesting your food. It gets it wet so that it can start down. And it does initiate a little bit of digestion of complex carbohydrates. Another name for complex carbohydrates is starches, right? And so it's salivary amylase will start breaking those up. It started on downstream. One of the ways to diagnose mumps, by the way, is to do an amylase test, serum amylase test, because if the parotids and the glands get really swollen, remember they make this amylase enzyme and it'll appear in your blood. Same as in pancreatitis. The pancreas makes a lot of amylase as well, and it's a good test to tell whether somebody's sick in the pancreas. What controls it? Well, I think I've already talked about that enough, and I don't think we need to beat that to death. For those dental hygienists and dental assistants in the class that want to go into that field, here's your moment to shine. This is we're going to discuss the teeth, and the teeth are really important. I'm kind of glad I have all of mine, the tongue moves back and forth and moves the food around so that you can masticate. Masticate means chew. The tooth, you need to know a little bit about the anatomy of the teeth. The teeth consists of a dentin. Dentin is the main component of your teeth. It's very uncellular. Doesn't contain any cells. It's mineralized. It's sort of like bone looking. I'll show you pictures in a second here. In the middle of each tooth is the pulp cavity, and the pulp cavity is really an empty space where the blood goes up and through the artery, and the blood comes down through a vein, and also there's roots that go up there through the pulp cavity, which is oftentimes referred to as the root canal. We'll talk about root canals in just a second. So the root, every tooth has a root. Some of them have 2 or 3 roots. But the root sits down into this little socket in your bone called the alveolus. And this ridge of gums is often called the alveolar ridge. Alveolar ridge, because all the alveoli stick in there. There's a little layer of cementum or cement. It's kind of like super glue that holds the tooth down in there. And then on the top of the tooth, the part that's exposed, the part that you can see, it's all covered with enamel. And enamel is the hardest substance known to mankind. It's even harder than diamonds. Keep that in mind. It's very hard, and when it rots, and when your teeth rot, they usually rot from the inside out, and from the edge of the gums when you get periodontal disease down alongside your teeth on either side. So these gums, there's 2 of them. The upper one is called the maxillary arcade, or the upper dental arch. The lower one is called the mandibular arcade, which is your lower teeth. You knew that. Here's a nice picture of a tooth. And here is here's the pulp in here in the middle. It's really kind of hollow. There's not much in it except some nerves and some blood vessels. This is the dentin out here, this kind of brownish stuff. It looks like it has some bony, it sort of looks like bone actually, that you see out here. And then on the very outside, on the part that's exposed, you have the enamel up here, the white that you see. This layer of cementum is illustrated right here, coming down like this. It cements the tooth into the alveolus. You see, this is bone right here. This is just spongy bone that makes up the ridge. The biggest problem in dentistry, I think, these days, although in Portland we don't have fluoride in the water, so kids still get a lot of cavities, but most folks don't. And if you use fluoride toothpaste, you're getting a little bit of fluoride. That's what you need to make your teeth strong and hard. Is periodontal disease, and what that is, are you a dental hygienist?
No, I just had gum grafts.
Oh, gum grafts.
That's right.
Oh. All right. So anyway, what happens is these little pockets alongside your teeth get full of stuff every day. Every time you eat, little pieces of food and seed and whatever gets caught down in there, and then it starts a little infection, and that infection then continues on down and sort of separates the tooth from the surrounding structures a little bit. That is why it's so key for you to floss, because when you floss, what you do is you hold the string, the front and back, and you kind of pull it down, and when you do, you kind of peel this away from it, but you also get all the junk that's in there out, and it keeps it clean, and it also makes these tissues grow back stronger so that you don't get periodontal disease, which will eventually cause you to lose your tooth. Now, many of you have probably been to the dentist before, and they've said, "Oh, you've got the start of periodontal disease here. You need to floss more." And you say, "Oh yes, I'll sure do that." But of course you don't. I keep a little plastic bag of those little things that have a little piece of floss, and I find it works just fine while I'm driving. I can floss my teeth, because I really can't stand doing it any other time. And plus, the people on both sides of me can look at me and I can go, "Yeah, I'm flossing." But anyway, when you go to the dentist, if you have had any troubles with periodontal disease, they will measure what they call measuring your pits, I think. And they basically put a little ruler down in it for you to see how far the ruler will go down. And you'll hear them, 4, 3, 2, 2, 1, 2, 1, 2. They call out all these numbers. And that's what it is. It's how far down it's open, okay? From the edge of where the gum ought to be, how far down does your pit extend? In other words, how much periodontal disease do you have? And if you have a lot, you really ought to get to work on it because it's not a pleasant thing. This is why people lose their teeth later in life, is because of that chronic infection. Yeah.
So when they say a tooth is dead, because I had a molar removed over the summer, does that mean that just all the blood vessels just aren't working in the nerves, or what does it mean when the tooth
Was
is
it
dead?
I don't know.
It wasn't my wisdom teeth.
Wasn't wisdom?
It was one of my regular molars. It was a root canal that went bad, that I didn't take care of.
Okay. Well, just real quick, what is a root canal? And let me get to you in a minute. Let me tell you my story about a root canal. I went to the dentist one day and I said, Mom, oh, my tooth is just killing me. It's been killing me for a week. And she looked at it and she x-rayed it and she says, oh, you need a root canal. And I said, really? She says, yeah, you need the root canal. Here, I'll refer you to this endodontist. Endodontist, that's the specialty dealing with the inside of the teeth. And so they gave me a little flyer about it, and they said, now here's what we're going to do. We're going to drill this little hole in your tooth up here, and then through that tooth we're going to take these really long drill bits that are really thin, and we run them all the way down here to the bottom of your tooth, and we just drill out all of this artery and this vein and this nerve, which kills them. And then they pack the nerve, the middle of the tooth, with something, calcium carbonate, I think, and fill them up. So then your tooth is now dead. You have no feeling in that tooth, and that's supposed to make you feel better. Well, being the skeptic that I am, I went home and I said, you know, she made me this appointment to see this root canal specialist, and I just don't like the sounds of that. I just waited about 3 days and the pain went away, and I've never had it since. So don't go running and getting a root canal. I think it's a pretty invasive thing, clearly, because they are going to kill the tooth. Usually the teeth, I guess they don't usually change colors after that, but I think sometimes they can. Susie.
So, when I played softball, and I lost this tooth and this tooth. They fell completely out.
Yeah.
And then I had to have a root canal done.
Right.
Both of them. But the dentist did something really different. It was like, I'd go in for a little while it was every couple of weeks, and then once a month. And then towards the end it was like every other month. And he slowly did the root canal, just a little bit at a time.
Oh.
And I've had them now for 18 years, 19 years.
Yeah. These two teeth in front on me are fake.
Yeah.
These are not my teeth. They got knocked out in a sailboat accident back when I was in the Navy. And they were both out laying in the sand on the beach. And we took them and stuck them back in my head. And they told me they would probably last for, 5 or 6 years at the most. They did root canals on both of them. They packed them with stuff, and then they came back a month later and changed the stuff inside, and then they came back again and changed it again. And then they put in the final stuff that's in the middle of the teeth. And sure enough, they did last. They lasted about 17 years. And I was in San Francisco, down on the waterfront at the Fisherman's Wharf, and I bought a loaf of sourdough bread. And I went, and I felt one of them just go, completely came loose. And I ended up having them both pulled out a few weeks later. And both of them were replaced with dental implants, which is the new thing. Basically what they do is they take a metal screw and they screw it down here into the bone, and then they hook the tooth onto that. So your new tooth is really connected to your jaw or to your maxilla, just like regular. It's just done in a different way. And you see these ads, which I think are really incredible, for Clear Choice on TV, where they talk about taking all of their teeth out and putting them all back in as implants in one day.
Oh.
And that's what they do. They do an MRI of their mouth, they figure it all out, they decide how many zeros to put after the price, I'm sure, and then they have you come in and they take them all out and put them all back in, which is a pretty wonderful thing. You know, all of my grandparents had false choppers by the time they were older, so, you know, they could have probably had 2 or 3 of their teeth done with implants and never lost their whole mouth of teeth. Yes, ma'am?
Do they give you a choice of like colors? Like
Yeah.
if you want like a silver tooth or something?
Oh.
Can they do that?
No, they gave me a choice of what color do you want it, and I said, well, try to match it with the
Yeah.
others.
They'll try and match it like to the pre-existing color of your teeth, and like
Yeah.
they try to do it a little slightly different so that as your natural teeth
That's not
like
fun.
Yellow.
age or
Yeah.
whatever, that like you're
Yeah.
not left with like bright white like fake teeth.
Yeah.
while your
Not
other
silver
teeth are,
ones.
like,
And you've
fake.
seen people that have super bright implants that don't really match the rest of their teeth anymore. But hey, they still got teeth, yeah.
One of the things is, I went, and one of those promotions that the dentist had was free whitening.
Yeah,
And so I asked them about it, I was like, oh, can I do that since I'm here? And they said, no, because you've had a root canal, and it will bleach all your other teeth. But since there's no inside to these ones, it won't bleach those. So I'll just be left with.
because they're fake teeth now?
No,
They're still your original
Yeah,
tooth,
but-
just root canal.
But they said what they could do is like drill out the back and then take out the filling and then bleach the inside of the tooth and then
Ah.
back it again. And I was like, no, we're good.
We'll just
We're
leave
good.
that alone, yeah. So anyway, the things to know, you know, the root of the tooth, the pulp, the root canal, dentin is the main thing making up most of your tooth. Enamel is up on top, it's very hard substance, and we'll call it good at that. And then the gingiva is another name for the gum. Gum is called the gingiva. And then these little sulcuses, this gingival sulcus is where food gets going, and that's where periodontal disease gets started. Dental suggestion, I love this picture that's coming up. I have to tell you, of all the pictures in all of the slide sets for A&P, I just love this one. You probably never thought about it, and I never had either till I saw this picture. Is like we were born and we have this first set of teeth comes in, our little baby teeth, and it's our primary dentition. They're called deciduous teeth, just like those trees out there are deciduous trees that lose their leaves, you know, so you know you're going to get them, but you also know you're going to lose them. And then in comes your secondary dentition, or your permanent teeth, also called milk teeth or baby teeth. Well, we won't make a big deal of that. Normally you only get 20 baby teeth. You have 20 baby teeth, and then you're going to get 32 permanent teeth, you know. So that's a number that's probably worth knowing. There's the baby teeth, there's just going to be 5 on each side, so 5, 5, 5, 5, that's a total of 20. And they kind of look like this, and please, you don't have to learn all this. It's not a bad thing to know that the incisors, you have 4 incisors across the front up here. And the 4 incisors are basically just for chewing, and or not chewing, but for ripping things off. And think about when you were eating raw animals.